This is Dr. Andy Yates on the Incongruous channel, and I'm working with some new software now to do better videos for your pleasure. So, excuse me if there's a glitch or two. Shouldn't be, though. It's pretty good, this stuff. And I'm working from notes. Well, not notes, bullet points. Anyway, this is a talk about hypnosis. And it's kind of a general thing, an overview of hypnosis, just to give you an idea. And because I've talked before about different types of holistic healing. And of course, in my world, this is one of them. I first qualified as a hypnotherapist with the American Board of Hypnotherapy in 1999. So I've had 25 years experience, which is a fair old run at it, isn't it? And I think that, I've seen a lot of different things, different clients, different situations. So it's nice to be able to talk about this to make sure people understand what a pleasant thing it is. It really is a pleasant thing. And, it's a nice experience. The reason is because it's something you do every day, multiple times every day. Let's get into it. Okay, so there's a lot of history with hypnosis, and it goes back right to the Greek sleep temples and the Egyptian things and stuff like this. But I like to start with a guy called James Braid, who was born in Fife in 1795, Fife, Scotland, right? And initially trained as a surgeon. I'm going to look at this ophthalmologist. See, I got it wrong. Ophthalmologist, and is credited with coining the term hypnosis. And he developed the technique of hypnotic induction, which is still used today. So it's pretty good. Now, in the 1880s, the term hypnosis was coined in France, and about 20 years after the death of James Braid. So we had hypnotism and hypnosis. Now, Braid used the term hypnotism in 1841 to describe a unique subject-centered approach, which was different from the operator-centered approach that the mesmerists that were around him were using. Now, mesmerists, there's a guy called Antoine Mesmer, and he was wildly popular in France, but he had this idea that hypnosis came from him. It was kind of like a superpower he had. And of course, that's not how it works. And of course, so inevitably, it was going to go wrong, and he was checked out, and he ended up being classified as a fraud and all this kind of thing, as if hypnosis wasn't a real thing. But of course it was, and this is where James Braid brought it into the real world. He later defined hypnosis as a state of mental concentration that renders an individual aware of other ideas and impressions. What you got to understand is, in those days, it was all about hypnosis being a phenomena, and you, as a hypnotist, were really cool if you could get somebody into a hypnotic state. And I don't like the idea of hypnotic state. I like the idea of altered states of consciousness. And we're going to discuss this as we go along, and you'll have a good idea of how that all works by the time we finish. But the point is, it's a natural thing. It's a good thing. It's good for everybody. Okay. And it's not, as he described, just about concentration, being aware of other ideas. It's the ability to talk directly with the subconscious mind. Well, what is that? We'll get into that. So hypnosis, an entirely natural function, and we all process it through many times a day. You cannot be hypnotized against your will, or hypnotized and directed to do something that you find unacceptable, which means your moral values that you have when you're in a full state of consciousness are there, and they don't change. And when you're in hypnosis, you've still got those same moral values. So you wouldn't go out and commit a murder, you wouldn't go out and rob a bank or do something like this, unless you're inclined to do so. You cannot get stuck in hypnosis. I've had some clients who have gone so deeply into altered states of consciousness, a deep, deep, deep state of relaxation, but not asleep. And it's their mind. And their mind will take control of it, and the mind will look after them, and eventually they'll just simply come back to full consciousness. It's as simple as that. So that's not a problem. You can't get stuck. Now, hypnosis is the Greek is the Greek personification of sleep. So it's a really bad name. Hypnosis is a terrible name for this, but we're stuck with it. Yeah, because hypnosis is not sleep. It's actually better known as altered states of consciousness in my world. All right. So let's have a think about it. Well, you've got kind of conceptually two different kind of sides of the mind. You've got the conscious mind, which is the less powerful part of the mind, and it's rational, analytical, and logical. The processing of the conscious mind works from the general to the specific. So what we're talking about is it inputs a single idea from multiple inputs and then creates a single conclusion. The Sherlock Holmes type of thinking. So it's receiving and processing information to the senses. And this is important because what it means is that it's the conscious that is connected to the outside world, to the senses through, our various different sense organs. But the subconscious, which we're going to talk about in a minute, is not. So whatever the subconscious gets, got to come through the conscious mind or itself. All right. It deals with language in many forms. That could be writing, that could be signs, symbols, all that kind of thing. Speech. It's preferable for sciences, physics, chemistry, biology, those kind of things. Mathematics particularly. And its thinking methods can be described as deduction and reasoning. And again, Sherlock Holmes would take a whole bunch of facts and then drill them down to one particular conclusion where he could then identify the culprit, the person who did the crime. You get that. Turn the page. Now, the subconscious mind is more powerful than the conscious. It is creative, perceptive, and psychic. The processing of the conscious mind works from the specific to the general. That is, multiple conclusions can be made and perceived from a single concept. The subconscious mind also has multiple skills, receiving information from the conscious mind or its own internal creation, and perhaps from some kind of psychic or spiritual source. It's concerned with art in all its forms, such as painting, sculpting, music, etc. It gives you a concept of multiple dimensions, infinity, God, spirit, ghosts, those kind of things. The things that the logical, reasoning mind just couldn't deal with. The thinking methods are sort of imagination, creation of ideas, and intuition. It deals with the emotions. It controls the autonomic processes of the body. Now, what is that? Well, autonomic is a posh word for automatic. And basically, it's like our breathing, our heart, our lymphatic system, the peristalsis that pushes food through our gut, those kind of things. And all of those, except for breathing, which we will come to in a minute, are not consciously controlled. Now, having said that, well, no, they're not consciously controlled. You can, by getting into a relaxed position, change your heart rate. Some say you can change the temperature of your body. But all of that's done from the subconscious mind. The other thing the subconscious mind does, which is very important, is it gives access to your memories. Well, when you think about that, that's why you use it hundreds of times every day, because you retrieve things from memory. The conscious mind's working through the senses. You're doing something, and then you see something, and then you try and relate that to something that's in your memory. So you're back and forth between your conscious and your subconscious all the time, thinking the fact that you use language, you've got to have a memory of language and what words mean. So flip-flop, back and forth. And it's natural. So the two minds work together constantly. They're interacting, changing thoughts. Input is received from the senses by the conscious mind, or as input received by the creation of thought or memory from the subconscious mind. So it all kind of piles into one. The subconscious mind is much more powerful than the conscious mind. Let me give you an example, and I'm not asking you to test this, okay, in any respect. Because hypnosis is a complementary therapy, and it's complementary to medical therapy. It can work along with it. It can help with certain things, but it's not an alternative. So just mention now, if you've got something, a pain, an itis, something like that, then you go to a medical doctor. But your process of going through any kind of treatment and stuff like this can be very much aided by the use of various types of hypnosis. Okay. Give you an example of the subconscious mind being stronger than the conscious. When a body is removed from a river by the coroner, and the coroner autopsies the body, he looks in the lungs to see if there's water inside the lungs. If the lungs are full of water, that means the person probably died in the river and took a breath of water. If the lungs are dry, then it's likely that the body died somewhere else and was dumped in the river. Makes sense, right? But then the question comes up, well, why would you take a breath while you're underwater? And again, I'm not asking you to test this. You can if you want, if you're healthy and you can do this kind of thing. If you try and hold your breath, you're using the conscious mind to do it, right? And you can hold your breath for a while, some people a long while, but at some point, your subconscious will force you to take a breath because it's autonomic or automatic. It will override the conscious mind and force you to do something. This is why it takes a great deal of focus. You can at some times try to overcome your subconscious mind with your conscious. And sometimes it can be slightly successful. But in this case, as you can see, you end up taking a breath underwater because your subconscious mind is stronger than your conscious. Okay. And there are various states of consciousness, which we'll come to. There is one little rascal that exists in this whole process. You've got the conscious, you've got the subconscious, and then there's another thing which I term, and a lot of others do too, the critical faculty. Now, the critical faculty is a thought interface that acts as a protective barrier for our subconscious mind. So things don't clutter up the subconscious mind that are not necessary. It also holds rules and beliefs and things like that. But let's go through this. It filters information, assuring alignment with our existing beliefs, values, and experiences. Well, logically, you can say that it prevents the change to our self and identity by rejecting ideas that don't fit with our established framework. Now, that means it's resistive to open-minded thinking, right? Thinking about the rules and beliefs that you have, you're then limited by open-mindedness. Now, by the lack of open-mindedness. Now, Albert Einstein used to go into a light altered state of consciousness. That way, he was able to bypass the rules, physical rules, physical laws and stuff like this that were current, and try and think outside of those to see if there was something else. And as I'm sure you know, he was very successful at that. Now what I've got is a diagram to give you an idea of this. Now this diagram, which I did a while ago for a different presentation, but it's still relevant, I think. At the top left, you've got input. And that could be input from the conscious mind. It could be input from the subconscious mind, thinking, emotion, stuff like that. And if we just go across to the right, we see conscious processing. So that's the logical, analytical, reasoning side of things. And then, almost as if the mind decides, right, shall I put this into the memory or not, it hits the critical faculty. And the critical faculty has laws, beliefs, rules, and so on that determines what you accept and what you reject. And you can see accept and reject on there. And you would reject things that do not fit with your beliefs, and you would accept things that do. And that's the problem. Because if you're trying to change the way you think, or change your attitudes, or change your emotions, or change anything, you have to think outside of those rules and beliefs. You have to avoid the critical faculty. So you can see if you look on the left-hand side of the diagram, you've got that input coming down into hypnosis, or achieving an altered state of consciousness. That then goes directly to the subconscious without having going to the critical faculty, and then it can be put in memory, and then once it's in memory, that may create a new belief right there in the center, which then can go into the critical faculty. So now you accept those particular things. Because if you're single-minded about things, which is fine, it's what you want to do, that's okay, but it does mean you won't think of alternatives, which you may find as being better. Okay? Being open to other things. And a lot of people think that's quite important. Could there be another answer to the question? Or is it just, hey, I believe it's this, and that's all I believe, and I'm not interested in anything anymore, which is the critical faculty stepping in and rejecting and discarding the idea. Do you get it? Okie doke. So let's talk about alternate states of consciousness. Now, don't blame me for the way these are named. Okay, they relate to different brainwave patterns, but I didn't want to get into all of that because for normal understanding, it's not necessary to go that deep. The top one, if you like, is beta, and that is the level at which we are communicating now. You are likely to be listening attentively. I am certainly attentive as I'm trying to work my machine here and make the presentation. That is called the beta state. And it's where the frequencies of the brain are the highest, if you like. It's a normal waking state. And it's the normal conscious and reasoning level. It's associated with a highest state of alertness, logic, and critical reasoning. You see, and that's where the critical faculty comes in. And it can also translate into some bad stuff as well, because you can stress about things that aren't true. Yeah? Because your critical faculty believes something and you're not open-mindedness to think of something else. Or to think of a calmer state of being so that you don't have to be in stress. Fear. When you realize that the little dog that scared you when you were a kid, now you're a big strong adult, isn't scary anymore. So those are the kind of things you need to be open to accept that, yeah, that was a kid's thinking. Now I'm an adult. I don't need to think like that anymore. I can be open-minded. I can change my beliefs. Do you get that idea? Another piece of paper. The next one is alpha. So what you've done is you've kind of come up to this level and then you've come down in your conscious like this. And I suppose I should say at the same time, the conscious, subconscious, which may have been down here, has started to come up. Yeah? Oh, that's messing my computer up, isn't it? Look at that. Anyway, you get the idea. The conscious is quiescing slightly, quieting down slightly, whereas the subconscious is getting a bit more dominant. This is the deep mental and relaxation state. The eyes are closed usually. It might be during a daydream. If you can daydream to your holiday in, I don't know, Tenerife, you're in an altered state of consciousness, because you can imagine yourself on the beach or sat in a cafe looking at the sea rolling in, listening to the sound of the waves, the gulls overhead, perhaps other people talking as they walk past, as you sip on your pina colada and feel the warmth of the sun, the sort of African sun as it is down there. Absolutely lovely, right? You can have all of those senses. Well, that's not conscious thinking, is it? Because you're not there. You're sat at your desk or you're sat on your sofa or wherever it is. You're not there. So that's the subconscious working right there, an altered state of consciousness. And it's the optimal time when you're in an alpha state to program the mind for success and heighten your imagination. It's the time for visualization, memory, learning and concentration. And it's the gateway to your subconscious mind and the voice of intuition. It's the point at which the subconscious can store that stuff in memory. Now, if you go deeper, so I'm tempted to use my hands, but the camera's going to get upset. Yeah, there it goes. Okay. I'll work on this. Theta. Well, in the theta, it's deeper than alpha and a lot deeper than beta. What does that mean? It means the conscious mind has quietened down even more. Okay? You don't go deaf or anything like that. You don't go blind. But your subconscious mind has started to kind of almost ignore the senses and stuff like this as the subconscious takes much more of a dominant role. This is true hypnosis, if you like, an altered state of consciousness. Deep meditation. Some even call it light sleep. It's not sleep, but some call it that. And it contains the all-important REM state, rapid eye movement state of dreaming, which, look it up online, a lot of scientists think that is very important for the proper functioning and maintenance of our brain-mind. It's the and the border between the alpha and the theta. So right on that, as you deepen through alpha and get to the theta state, that's the optimal mind range for visualization, where you imagine you're going somewhere else. You may have experienced visualization meditations where you've, in that state, gone to a castle to find something and it's beneficial because it gives you relief from stress or whatever, or extra knowledge or a better feeling of confidence and self-esteem. That sort of thing happens. It's the mental state where you consciously or subconsciously create your reality. And then if you go deeper, in other words, the conscious mind regresses, quiesces, quietens even more, and the subconscious mind becomes much, much, much more dominant, then actually you are going to go into sleep, delta. The delta state is a state of sleep, and that is deep, dreamless sleep in a very deep kind of transcendental meditation, deep hypnosis state where awareness is fully detached. But I say awareness is fully detached because, of course, like I said, you don't go deaf. Otherwise, you wouldn't hear the alarm clock go off in the morning and wake you up, would you? All right. So optimal brain states for hypnosis, hypnosis being the process whereby you can get positive changes. A light alpha trance is effective, but many therapists work with clients experiencing a medium level theta trance. What does that mean? Lightly relaxed, lightly, where the conscious mind is quietened somewhat and the subconscious is activated a bit more, all the way down to where the conscious mind is quietened right down. You become unaware of your input from your senses, and your subconscious is in charge. And again, let me refer back to that daydreaming, because that's what you do. You're sitting in the cafe sipping your pina colada. You are not aware of the room around you. You are not aware of sounds. Now, if a sound came along like an alarm bell, well, that would come through and it would instantly activate your conscious mind. And the conscious mind would logically and analytically and use its reasoning powers to realize that's an alarm bell. Then it would refer back to the subconscious and say, what does that mean? And the subconscious would say, that usually means danger, let's get the hell out of here. And then the conscious would activate the body to leg it out the door. You get the idea, you see, it's constantly going on. And again, it's perfectly natural. That's all it is. Okay. So the client is aware of, but not distracted by outside noises. We like many people like the deep trance states. The only problem with deep trance states is because the conscious mind is quietened right down. The client has problems communicate. Well, not problems, but it's difficult for the client to communicate to the therapist. And there are some techniques that a hypnotherapist learns to enable that communication. In a really deep state, you can actually open your eyes, which doesn't affect the hypnosis because your conscious is so far relaxed and quietened and so on that kind of, it's not that your eyes don't work, they just don't recognize and reason and logically analyze what the eyes are seeing. Any level of trance, even a light trance, can be effective if it allows your thought process to be addressed without the constant critical thinking of the conscious mind and the filtering effect of the critical faculty. So if you saw something that basically changes your mind, it's something you have never seen before, something you would not ordinarily believe in, unless you let it pass that critical faculty, you just won't believe it. Yet you've just seen it. There it is. Most people in a light to medium trance remember what is said during that hypnotic state. And in a very deep trance, the subconscious mind hears and makes changes, but the subconscious mind may not remember what is said. And it's not necessary for you to remember what's been said. And in fact, it may even be better for you to avoid directly addressing some kind of a trauma, phobia, that kind of thing, until it's been softened and lessened by the process of hypnotherapy. So the hypnotherapist may actually suggest that you don't remember it, but generally you're going to remember it. So that's quite important. And just as an aside, when you think about that, this idea of not being deaf, this is why people in an operating theatre, the doctors, the nurses and so on, the anaesthetist, need to be a little bit thoughtful about what they say, because the patient can hear and the patient can process those words. And if the doctor said, oh God, there's not much hope with this one, that goes in the mind. Whereas if he says, well, we got our work cut out here, but I think we can make a good job and do our best. Something like that, a lot more positive, you know? Something to think about. Okay. So the power of hypnosis. Well, once you've reached the hypnotic state, you're in a state of focused attention, deep relaxation, and a detached kind of parallel awareness. The therapist addresses your subconscious mind directly. So let's quickly just go back to this because it's here and I've got the tech to do this. And there we go, through hypnosis. We can see input through hypnosis, left-hand side, and subconscious. And then that can be stored in the memory and also create a new belief. Good stuff, eh? And that can change your learned patterns, your pattern making, your behavior, especially where it may be negative behavior that you want to change, negative behavior that you want to change, like smoking or drinking too much or losing your temper or stuff like this. Those kind of things can be addressed in that state, because you become suggestible to desired change, positive therapeutic results. So again, how does it work? Well, your conscious mind is quietened, quiesced. You're able to access the part of the brain where your thoughts, beliefs, perceptions, sensations, emotions, memory, and behaviors all originate. This is where they live. And obviously, it's difficult to change those things if you address it through the conscious mind, because you've got to go through the critical faculty, and that may block you. In this state, you're more open to the gentle guidance of a therapist, and that can help you modify or replace your subconscious thoughts that are driving your current, perhaps unwanted, negative behavior. Now, looking at some of the myths of hypnosis, because hypnosis isn't a stage or a magical act. Clinical hypnosis is a type of medical therapy that's often used as part of a treatment plan that includes traditional medical approaches. So it's a support, a complementary therapy to medical therapy, medical processes, medical practices. Hypnosis, unlikely to fix a broken leg. You're going to need it set. You're going to need it operated on. You're going to need it sorted out. But hypnosis and other kind of complementary therapies can help with the healing process, can help with the stress that might be related to some kind of a operation or something like that. It can help a great deal, and that improves the function of the immune system, and that improves your recovery rate. Such good stuff, isn't it? Yes. So it's not part of a magical act, but you may ask, well, I've seen these hypnosis acts. I've seen them on the street and doing things like this. How does that work? It's all down to suggestion. And here's the key. The client, the patient, the subject, whatever you want to call them, has to agree to do what the therapist or the hypnotist tells them to do. And they may do it when they're in a relaxed state of mind, but they've still got to agree. For example, there you are in Vegas, right? Done this myself. There you are in Vegas. You say, hey, let's go and see this hypnosis show tonight, as we're hypnotherapists. See what it's like. That you've said, yes, I'm going to go to a hypnosis show. You pick up the phone, you call them, yes. You give them your credit card number, yes. You go down to the place at the right time, yes. You go through the doors, yes. You sit down, yes. And you sit in an audience of people where you know that the hypnotherapist is going to come on stage and he's going to want to select members of the audience. And you're sat there saying yes. You see the way it works? It's what we call a yes set. Then he'll carry out what he may call suggestibility tests, because he wants the people that are going to accept his instructions and play along. He doesn't want people that are going to be resistive. And one of the best skills that perhaps street hypnotists or stage hypnotists have is selecting the right people, right? So anyway, they say, oh, do this, do that, lift your finger, hold your leg up, whatever it is. And then they'll select, say, 12 people. And he'll say, if you want to, please come up to the stage. Yes. And they go on the stage. Please sit down. Yes. Right, put your feet flat on the floor. Yes. Put your hands flat on your thighs. Yes. You see what I mean? Over and over and over. You're programming your mind that whatever this guy says, you're going to say yes. Right? And that's the way it works. And when he says, right, when I count to 3 and I tap you on the shoulder or whatever it is, you are going to go into a deeply relaxed state. And at the same time, I will say sleep because it works for the audience. And he goes on tapping people on the shoulder. 1, 2, 3, sleep. 1, 2, 3, sleep. 1, 2, 3. And because they've agreed 20 times, they've said, yes, I'll do what you tell me to do. So when you tell me to relax. And he's also good at getting rid of those ones that are just playing along and not taking it seriously, and he'll kick them off the stage. Good stuff. So that is real, and that is the same sort of thing. But if at any point one of those people on the stage was asked to do something that they absolutely would not do, that is absolutely out of their moral compass, they wouldn't do it. Couldn't force them to do it. Could not force them to do it. And there's lots of examples of people who supposedly have been hypnotized and they just simply do not do something if it's a bad thing to do. Anyway, so it's not a hypnosis. It's not a stage act. It's not a magical act. It's a type of therapy that's quite reasonable and respectable. You do not lose consciousness or have amnesia when you're hypnotized. Your conscious is still there, but it's just quietened. Quiesced is a word we often use. Okay? And again, most people remember everything that happens during hypnosis. You are not being controlled. Your therapist guides the hypnosis. But the hypnosis is something you do for yourself. So basically, you relax. The hypnotherapist says, just relax. And you relax. Just go down into a calm and peaceful state. You go down and down and down. I won't use the words because... But people just relax down because they want to. And it's a pleasant experience, so it's nice to do. It's not scary at all. It's wonderful. In fact, we talked earlier about people getting stuck in hypnosis, and often people are reluctant to come out of hypnosis because it feels so good. It's such a pleasant place. They might be, because the subconscious mind is capable of creating these kind of illusions, they might imagine they're floating on a cloud somewhere. They might imagine they're swimming in a crystal clear coral sea. You know what I mean? They might imagine they're sat on the moon looking back at the earth. I don't want to come back because it's like, this is wonderful. Anyway, you get the idea. The other thing is you won't reveal any information that you do not want somebody to know. So if you've got top secret clearance, you're not going to be telling any secrets. And the interesting point about that is I know at the end of the Korean War, the Koreans, North Koreans, actually had a lot of GIs, General Infantry American servicemen, who were prisoners of war. And they tried to brainwash them using things like isolation tanks. So you're floating in a tank of water at body temperature, so you can't even feel anything around you. And there's no sound and there's no input and there's no light and stuff like this, just to access your deeper mind, and tried to program them, you know, that communism was the best thing since sliced bread. And their version too, which isn't communism. But there we are. And but what happened was they were convinced to a tiny, thin respect, but as soon as they got back to America, probably as soon as they stuck the first burger in their mouth and had to chug down a Budweiser, they were back to being American again. It just didn't work because they didn't want to do it. Because your mind is your mind and no one else to control it. That's important to think about. Okay. So you don't lose control over your mind. You don't lose control over your behaviour. Oh, there's another page. There's probably more pages. Well, that's messed things up. I'm on page 4 and I'm looking at the bottom of page 4 and it says, and this is the next thing. And I'm like, I haven't got that bit. Oh, yes, I have. Anyway, okay, let's carry on. So there are a lot of conditions that can be dealt with hypnotherapy. But it's important to note that a lot of them should be checked out by a medical doctor first. And like I said, hypnotherapy can help. So some examples: insomnia, asthma, hot flashes during menopause, gastrointestinal disorders, including irritable bowel syndrome, IBS, pain control, here. Now, here's the case, you see, because if you've got a pain, generally that's a signal that something's wrong. Okay? And it will take a medical doctor to say, it's just a headache, or you had 8 pints last night, no wonder you got a headache. That sort of thing. Or they might say, well, I think it's just a passing thing. People get headaches for one reason or another, dehydration, that sort of thing. So make sure you drink enough water, keep an eye on it, and if it's a problem in a few days, come back to me. Well, then no problem. You may then want to go to a hypnotherapist and say, this headache, can you help me get rid of it? But it's important to consider the medical aspect. Pain control: after surgery, childbirth, cancer, fibromyalgia, burns and headaches, migraine, tension. It can even help with things like warts, psoriasis, eczema. And it can help very much with the side effects of cancer treatment like chemotherapy and radiotherapy. And of course, that often leads to nausea and vomiting, and it can also help with that. Also, because this is endless, isn't it? It's wonderful, the benefits. Self-hypnosis can be achieved yourself by deep breathing, imagery, progressive relaxation, those kind of things, just as you would do with a professional or a professional acting hypnotherapist. Okay? So you might be able to help you manage your own stress, your own tension, your own headache pain, your own non-serious headache pain. But if it's pain, generally, and if it lasts and it's, pain, quite strong, then go and see a doctor, medical doctor. Regression therapy. Now let's have a think about that. Now, regression therapy, there are different types. There's hypnotic regression, age regression, and past life regression. And here's my take on those things. Hypnotic regression therapy, well, it's where a therapist uses perhaps imagery, physical sensations, and your feedback to guide you through the past. So during a session, you may feel a particular sensation, and the hypnotherapist may ask you to concentrate on that situation, that sensation, and ask you, has that occurred in the past? Go back to a time when that occurred in the past. That's the way that works. When that significant memory is found, and if it's appropriate, then it can be released or reframed. It can be made into something different. Or it can simply be, there are a series of visualizations and things by which you can totally release those things, especially if it's something that comes from when you're a child, because when you apply your adult brain, your intelligence, your knowledge, your skills and so on, you'll look at a phobia or some issue that happened when you're a child, and you'll be able to much better deal with it because you've got all those extra skills that you developed over the years. Now, age regression therapy is where it's driven by age. So the therapist will guide you to a specific age or a past event. And relaxation and clinical safety can make traumatic memories less frightening to address and process. Because to a therapist, well, to me anyway, because I've always been a gentle therapist. I've never been a hard therapist proving my own ego. I've always wanted the best for the client. So if the client clearly has something that's really upsetting them in the past, we might dance around it a bit. We might approach it gently. We might change its colour, its size, make it black and white, turn the volume down on the telly, where you're watching it. All kinds of tricky, clever techniques that you can use. to gently address such a thing until it becomes to a point where you can fully address it without kind of causing any trauma. And that's the point. Okay. And these kind of techniques, dissociation techniques, you can watch it on a TV, you can watch it on a movie screen, you can just listen to the sound, you can even use things which are more a slightly different version of hypnosis, if you like, where you can imagine you create a doppelganger, a twin, an imaginary twin, and then that twin goes forward and investigates that trauma rather than you. And you sit back and you watch that twin doing that. That's a very, very good technique, very powerful. And then eventually you bring the twin back into yourself. It's all good stuff. It's all good stuff. Also, I found that there are some issues that just don't want to be recovered, and I respect. Remember what I said, your mind is your mind, nobody else's. I respect the fact that your mind may have determined that it's not good for you to recover this memory at this time. And so therefore, I just leave it alone. I had a couple of guys who were thought they had lost time, and they thought it might be due to an alien landing. It's a client, you take him seriously. And I recovered their memories up to a point, or they recovered their memories with my direction, up to a point whereby they were going through the woods and the light was getting brighter and brighter and brighter and the noises were getting louder and louder and louder, and then it would stop. And I gently tried to push around this mental barrier and it wouldn't go. And I was just like, okay, your mind wants to keep it. When it's the right time, it will come up. And it's as simple as that. Okay. Right. So that's deeply recovered issues. So another thing a therapist will be very cautious about is planting suggestions or false memories. And there's been some troubles that you may have seen in the papers, mainly in the past actually. People are a little bit more careful with this now that we know it's a really important thing. But it's just like a policeman interrogating a suspect. Most, I'm not criticizing the police, most interrogators only ask questions. They don't make suggestions. Where were you on this sort of night? What were you doing? Do you know this person? Why was there blood on your shoes? If they said, we know you were in this place and your purpose was to go and kill that person and that's how you got blood on your shoes. No. Because the guy hasn't admitted to anything. This is what the detective said. And a defense lawyer would tear that apart. But in a therapeutic sense of things, you don't want to suggest anything because you might have it wrong. You know? There have been some terrible things where people have said, oh, you know, I almost don't want to go into this, but was your dad touching you in a private place? I mean, it's like, oh no, you've got a kid and you've planted that. Don't do it. You know, because there's other ways you can find out just by clever questioning. So that's important with any kind of regression therapy, is to really be careful not to make suggestions and not to plant false suggestions. Okay. So let's move on to now one past life therapy. Here's a fun one. Past life therapy, it's controversial. It is a hypnotherapeutic technique. And it claims to help people that remember lifetimes and associated trauma that existed before they were born. Now, I put it that way because maybe it wasn't their lifetime. Oh. Because a lot of people who want this kind of therapy or, support this kind of therapy believe in reincarnation. But when you think about it, somehow maybe you could access somebody's memory or the disturbances they made in the energy of the universe. some other way. This is not your memory, it's someone else's. I don't know. I really don't. I know there's something there though, because I've seen it happen many times. There is actually something there. And I'm just like, wow, that is something. For example, I'll be working with a client, say using age therapy or some kind of event therapy to regress them. What happened before that? Can you remember a time before that? Tell me about the time before that. Tell me about the time before that. Tell me about the time before that. And you get them to a really young age, and then they suddenly say, and you say, tell me about a time before that. And then you might ask, where are you? And they'll say, I'm in a castle. Oh, okay. What's the castle look like? Oh, it looks really good and everything. There's banners on the walls. There's people moving around. There are people doing stuff. There's a little fair in the middle of the castle courtyard and they're selling some stuff and so on. What are the people dressed like? Oh, they're dressed in kind of tabards and tunics and singlets and stuff like that. What are you dressed in? I've just got a smock on. What's on your feet? Sandals. And you're like, wow, this is really interesting. And you go into it. And it might be helpful because the idea is that with past life therapy, let's just take the case that reincarnation is true, that something occurred in that life that has changed you so that it's still occurring in this life. So if you resolve it in the past life, you can bring it forward and resolve it in this life. But in a way, it doesn't matter. And a lot of people think that past life therapy is actually just kind of role playing, and that the mind is playing out a role in order to help it, resolve an issue and uncover those things, because it kind of labels subconscious issues and trust of your parents or trust of your siblings or whatever it is. It kind of labels it so that then the therapist can deal with that. So regression therapy can be used to find the root and then lessen or release the source of the problem, the phobia, the trauma, whatever it is. And it's often unexplained pain. And that could be mental pain or even physical pain. But again, you just got to be a little careful about how you apply it and make sure you follow these things. And I used to operate mainly in the United States, and boy, you need to check local laws and stuff like this because you can put yourself in the mud very easily. Okay, so what's the value? Well, we've talked about that. It can be effective, and again, with the medical kind of waiver, regression therapy can be effective in treating anxiety and depression. It can be useful in dealing with post-traumatic stress disorder, PTSD, phobias, low self-esteem, insomnia, migraines, unexplainable pain. So I kind of talked about hypnosis just from the point of view of saying that it is natural, that it is helpful, that it's not in any way harmful, that there's no way you can get trapped in it, there's no way it can cause you a problem in that way. Plus trying to make it very, very clear that your mind is your mind. And you don't have to believe other things that people say, right? But I do suggest being open-minded, because you've got to, well, you haven't got to, but I feel it's beneficial to allow your mind to be open to new things, new perspectives and so on. And then if you don't like them or you don't believe in them, kick them out. Or what I like doing is just kind of pushing them to the side, because you never know that other facts may come up in the future that may in fact make you think, oh, well, that was right then. That was true. You know, when the alien arrives on the White House lawn, then you go, God, that was true. All those things. Anyway, you get the idea. Yeah. So, and I'll give you an example here. Things have changed a lot. hypnosis used to be considered a kind of spooky, scary thing and stuff like this, and it isn't. And let me give you an example here. This is from the Royal College of Psychiatrists, Royal, so it's UK, December 2023, so it's pretty up to date. They said in one of their journals, the effectiveness of hypnotherapy depends on the individual. Studies have shown that hypnotherapy can help to treat a range of physical and mental health conditions. A skilled therapist can also adapt suggestions in hypnotherapy to specific problems and measure your progress across sessions. In many cases, hypnotherapy and other uses of suggestion can provide fast, effective treatment. Now, one of the points here is, in the past, psychiatrists, because they're medical doctors, have kind of poo-pooed a lot of this stuff and don't want anything to do with it. And I think what's happened is we've now come to a place where it's a tool in the box. It's a tool that can be used for psychiatrists, psychologists as well. Because let's be honest, as soon as a psychologist, say, asks their patient or client and says, right, just lie down on the couch, take a deep breath and relax. That's hypnosis, right there. Right there. And they relax into a light, altered state of consciousness where they are more open to perhaps suggestions or solutions that come from the psychotherapist. You see what I mean? So it's quite a normal thing, quite openly used. And I think that's very good. And it's a delight to know that that's happening, because it was a pretty lonely environment when nobody wanted to talk to you. It's worse in America, of course, because hypnosis does not involve any money for big pharma, for any of those kind of things. So it's not licensed and it's not accredited. So you'd always want private treatment, and then after the 2008 crash, no one had the money to pay for private treatment like that. They pay for private medical insurance because then they could sign up for 20 sessions with a psychologist, which might be useful, especially if they use altered states of consciousness. But that's the way it works. But hypnosis, no. You could get hypnosis prescribed as a treatment by a medical doctor, same as some of the other New Age therapy, not New Age therapies, complementary therapies. Sorry, I'll get these wording right. Complementary therapy is like massage therapy. A doctor could prescribe sessions of massage therapy for a particular back issue. A medical doctor could prescribe sessions of hypnotherapy to help somebody stop smoking. So there we are. So it's lovely that this has all come together, that hypnosis is there ready for you. And the UK is a lot more open to those things. I think because we have such a diverse culture, because we have such much more of an open society in that way, and a lovely, lovely history of much more natural solutions to human issues, that we're more open to that. So anyway, that's hypnosis, hypnotherapy, hypnotists. Bit of an overview for you. Hopefully it's been helpful. Hopefully it would make you consider that might be something you want to do in the future. But of course there's no, I'm not pushing you to that. But hopefully this makes you feel it's a little bit more acceptable. There we go. My name's Dr. Andy Yates. This is the Incongruous channel. And you guys, please take care.